Doctor, let's talk about cancer a little bit. Talk about some of the treatments that you used and why were those successful versus especially
successful?
what
You find out,
traditionally...
I use a three-pronged approach. You'll hear about this tomorrow when I lecture tomorrow and in my meeting tomorrow on cancer prevention. I use a three-pronged approach. I detoxify the body. A cancer patient's always toxic. You've got to get, that's why Gershon was so successful. He got the liver working right. The liver is the biggest detox organ in the body. And I detox, okay? I use zeolite, which is an extract from volcanic ash. Pulls all the chemicals and heavy metals out of your system. Okay, I use coffee enema some. I'll use milk thistle, which detoxifies the liver. I use a lot of alpha lipoic acid. Alpha lipoic acid, our lipoic, will regenerate a dead liver. Okay, so I use a lot of that stuff. Okay, and then you've got to stimulate the immune system. I use a ton of stuff to stimulate the immune system. They've tried to take everything away to stimulate it, but we still find a lot of stuff that does it. There's a product called NK Stim, natural killer cell stimulators. There's several companies that has those, natural killer cell stimulators. I use a lot of orthomolecular stuff, and they have a product called NK Stim, okay? I use an AHCC. We used to have MGN3 and they took it off the market. Well, the people that made that knew that they had a product that was 3 times as potent as MGN3, so they didn't bark about it. But they took MGN3 off the market because they wouldn't change their advertising, okay? But AHCC stimulates the natural killer cells to be aggressive. I use it. I use a lot of vitamin C. Ton of vitamin C. When the boy gets his practice going, they'll probably use 40 to 50 grams of intravenous vitamin C every day, every other day. Will kill almost any disease you got going on in the body without any side effects. Okay. Then I use a lot of colostrum. If you get colostrum from organic cows within 8 hours of a calf being born, you get pure colostrum and no milk solid. The colostrum, bovine colostrum, is not species specific, and it's 1,000 times more potent than the lady's colostrum. Well, I use that. I take it. I use 1,000 milligrams of colostrum twice a day. Okay. I'm not going to let things slip up on me by accident. You know, I'm going to let my patients get better than I am. Let's put it that way. And by the way, a doctor that won't use on himself what he uses on his patients is a crook. Dishonest. Okay? There's a reason why drug addiction, alcoholism is so high in the medical profession. You got to face yourself in the mirror. Okay? Yeah. Now, the third thing. You detoxify the patient, you stimulate the immune system. Then you've got to knock the disease process down without killing the patient. I use anything I can get my hands on to do that. I use graviola. The same people that make graviola have a product called Intense, N-T-E-N-S-E. We started using that on leukemics. It'll turn leukemics around, okay? I use a lot of vitamin C. I use cesium chloride. I use milk thistle, or not milk thistle, mistletoe. I use Essiac tea. You name it, I'll use it. I use hydrogen peroxide, okay? I just want my people to get better. And I'll give them a list of things, and I'll say, okay, choose from these the things that fits into your schedule economically, and that you can handle as far as the rigor of diet and the likes. And I give them a diet. They don't want to change their lifestyle. Don't come to me. Yeah. If you're looking for the doctor to do it, not going to happen. I got a lady down here right now. She's met me today down here. She's had breast cancer for 3 years. Okay, she's taking it to the next level. I just point her in a direction, and she knows more about health than I do. Okay, you got Dr. Chi down here. We use a lot of Dr. Chi's formulas, his angiostop and his kidney chi and myomins. Okay, I use a lot of that stuff. Again, prevention. You don't have to wait till it happens. We know that when ladies get over 35, 40 years old, someplace between 35 and 50, ladies run out of progesterone. When they run out of progesterone, the progesterone goes down, their estradiol goes up. Estradiol is how we fatten our beef, our pork, and our chickens. That's how we fatten our people too. And it's also the biggest cause of cancer. All of our hormone replacement therapy is estradiol. You know, when a man gets over 35 to 40, testosterone goes down, estradiol goes up. So it swells our prostate. You show me a man over 50 that's losing his memory, I'll show you a fellow that's testosterone deficient. I mean, just little things like that.
To stay ahead of it.
Yeah, why do we have to wait until we get prostate cancer before we do preventive stuff? You know, and nearly every company has some herbs and herbal combination to stimulate testosterone production. I use transdermal testosterone cream, low dose, so it doesn't shut my testosterone level production down. And I'll take a couple of potions to stimulate testosterone production. And then I'll take Dr. Chi's myomins, either that or estradiol, to keep estradiol from being high. Now, let me reason with you for a minute. Every lady has a breast tumor taken out of her breast has to have that tumor checked for estrogen receptor sensitivity by law and progesterone receptor sensitivity. Okay? A lady produces estriol dominant hormone. A horse produces estrone dominant hormone. Pharmaceutical companies make estradiol. When they check those breast tumors, 85% of them are estrogen receptor sensitive. Would you like to know what estrogen they use to check that? Estradiol. You don't have to be a rocket scientist to figure out what grew that. And they'll check progesterone receptor sensitivity, and there'll be 15 to 18% progesterone receptor sensitivity. Would you like to know what progesterone they use to check that? Progestin. Okay? Now, I have a lady that has breast cancer or uterine cancer. I give her estriol and bioidentical progesterone, and I about have to resuscitate. The oncologist and the pharmacist, I get nasty letters from the universities. We can't agree with this lady's protocol, but she's not going to change, and she's doing well, and she hasn't had any regrowth. You know,
There you go.
a lady that's had breast cancer is still not a lady. You know, we were taught in osteopathic school, and the MDs are taught the same thing. The cause for prostate cancer is too much testosterone. Try dihydrotestosterone. Okay, if you do a free testosterone level, all those people are low in free testosterone and high in dihydrotestosterone. What if you don't do something to block dihydrotestosterone? You're going to keep converting. The older you get, the more of that testosterone you're going to put into dihydrotestosterone. Supplemental block that real well.